So the Council for Medical Schemes gave its stamp of approval to the merger of Hosmed Medical Scheme and Sizwe Medical Fund. I'm joined by the Principal Executive Officer of Sizwe Hosmed Medical Aid, Dr. Simon Mangcwatywa. Thanks so much for your time on SABC News today. So CMS previously did not allow that merger. I think there were court challenges as well. Give us some context into what's happened before and how you got here.
Thank you very much. I hope you can hear me very well. Good day to you and your viewers. What we really want to celebrate today is really the amalgamation and the merger of these two giants coming together. But you are right. It has been quite a tough a journey for us to get here. We initially started this journey around October and April 2020, and it is a journey that we have been on. There has been a lot of challenges, but what we really want to concentrate on is really the merger and this happy marriage that we finally got underway.
All right, while you're in the honeymoon stages, then explain to us what the Sizwe Hosmed Medical Scheme looks like post that merger.
Okay, so what we have been able to do is to bring together two very formidable schemes where we're taking our membership to a little less than 70,000 beneficiaries, which puts us at the 8th largest open schemes in this country. Not only that, we do have very good healthy reserves, and we are number 4 in the country when it comes to reserves. So we're quite happy about that. We believe that the larger and broader option range that we are able to offer our members really bodes well for them and their families, their specific needs in terms of what it is they need for a medical point of view. So we're quite excited about it. It's a historical measure. We think that it is one of the biggest, at the very least, in the recent history of this industry. It is the biggest in the history of both Sizwe and Hosmed. And yes, we are in a honeymoon stage. There's a lot of work to be done. But yeah, it's good news to be celebrated.
All right, and I know one of the issues that came up previously was the issue of transformation in your field. Talk to us about the ownership of Sizwe Hosmed, how transformed that company is and more.
That's right. Thank you very much. So because medical schemes are essentially non-for-profit organizations, they are largely, in fact, solely owned by their members. And our membership really reflects that rainbow, a nation that we've all been waiting and wanting to work towards. And therefore, we've got all sorts of people as our members. What we are most proud of is that we are one of the few medical schemes that will be black administered in the country, and that will be black run. And really, while we embrace all races in the scheme, I think that our management composure and the composure of the administration, who is black-owned, BEE level 1, really talks to a lot about what company we are and our ethos as a company.
All right, then talk to us about the governance of Sizwe Hosmed going forward. What is the board looking like?
Yeah, so we put it to our regulator, the Council for Medical Schemes, that when we do merge, that we will have to have the two boards coming together and forming one board. And at the moment, we will be constituted of about 20 members sitting at the board. However, we have also told the Council for Medical Scheme, who is our regulator, that we will be whittling that number down all the way to around 12 and 15, which is much more manageable. So as soon as we have meshed now, the process is to say, how do we then whittle down this board to be manageable to around 12 to 15 members. It will take a little bit of time, but we don't intend to run a 20-member board going forward.
All right. How is this going to affect members of what were the two previous medical schemes?
What we were quite careful of doing is to make sure that when we do have this measure, that none of the members from either of the schemes are negatively affected. Negatively affected from a point of view of their contributions, negatively affected from a point of view of the benefit options that they've been enjoying. So we've been able to maintain. So the members have not been negatively affected. And in fact, on the other hand, what we have seen with the measure coming together is that we will see a drop in our non-healthcare costs, which bodes well for the member because that money goes straight to the members. Number two, and most importantly for us, is that we grow our reserves from 31% all the way to 36%. We are mandated to have reserves of only 25%. And this combined scheme is going to be having reserves of 1.3 billion rands, which translates into 36% or so. And that money belongs to the members. So we can use that money to help members through issues like COVID. We can use that money to enhance the options that we have in the scheme. So members are really not negatively affected at all, and in fact, they stand to gain from the measure.
All right. So very briefly, we don't have a lot of time. We are in the middle of a global pandemic. Just want to find out your views on the NHI and the impact that will have perhaps on the sector going forward, as well as vaccination and mandatory vaccination in South Africa. And lastly, the CMS saying some schemes like Hosmed and Sizwe haven't applied for exemptions and they worry that their members may not be offered adequate financial relief.
Yeah, so what we have done is it's quite a number of things that we need to unpack there. First of all, as Sizwe Hosmed, we welcome NHI. We welcome NHI from a point of view of equity. All our people, all South Africans need to have access to good quality health care. We have let the minister know of this. We have not only that, we've opened our doors and say, how can we help the Department of Health? How can we help the minister to achieve this dream? There are issues that we have talked to them about that are of concern to us, but those are in the details. The principle is that we would want to see NHI come into fruition. We think and we see really this industry having a huge role to play in terms of helping, assisting the government in terms of rolling out NHI in various ways. And again, we can go into the details around that. So we do not see us as polar opposite of each other. In fact, we think that this will be beneficially for both the industry and government. Look, the COVID issue is a big issue around the world, and there is a move for this mandatory vaccines. We haven't taken that step yet. What we have done is innovatively encouraged our members to get vaccinated, and we can see the numbers going up. We are deliberating on having a specific COVID policy. It does not include at the moment mandatory because we believe that we don't need to get to that level. But we will see where the world leads us. We will see what the requirements from government would need from us. But at the moment, our members are really free to get vaccinated. We encourage them to do so, but it's not mandatory at the moment.
All right, so it seems that we're not going to get around to that question around the exceptions. Thanks so much for your time on SABC News this afternoon. Dr. Simon Mangcwatywa joining me there from Sizwe Hosmed. He is the Principal Executive Officer. It's time for a short break.